Hi friends, Dr. Pandya here. I am here on a Thursday afternoon after 5. Patients are over and I'm analyzing an esophageal manometry that I did today on a lovely lady who I think had an extremely relatable story. So here's a lady who is middle-aged, not that young, not that old, like most of us, like me too, who kind of had some heartburn here and there throughout her life. She knew that. It was something that she dealt with by being careful what she ate, maybe taking some Tums or something occasionally, getting by just like most people do occasionally, and that is kind of a normal human experience, right? Now, the thing is that in the recent past, she had a health scare, totally unrelated to heartburn. And she developed a lot of worry, a lot of anxiety, a lot of difficulty sleeping, just a lot of different types of stress that accumulated while trying to understand more about the other health scare. Now, thankfully, that issue got analyzed and she got appropriate diagnostics, and everything turned out to be normal. And what she thought was, gosh, during this really stressful period, my heartburn has become really unbearable. You know, she developed pain in that upper part of the abdomen, lower part of the chest, like a fullness or a burning sensation or a kind of a hot sensation, maybe feeling like things get stuck in the throat or there's pressure in the chest, having a hard time sleeping when she's laying down completely flat, maybe sometimes sleeping on the sofa so that she could be propped up a little bit, which is great if that helps you get some sleep, but it's also very disruptive to your normal sleep, right? Because you're not sleeping in your normal way. When we don't sleep well, stress builds up. Our ability to recuperate and regenerate during sleep doesn't get a chance to happen. And so even though her health scare finally got resolved, turned out there was nothing wrong to really be worried about long term. And yet, after that, she discovered that her heartburn symptoms did not go away. That flare-up or that over-the-top symptoms that she started having, they became her new normal. And now, of course, this is the new worry. This is the new stress. You know, she doesn't want to be sleeping on the sofa or struggling to know what to eat or not being sure what she should do in order to keep her symptoms under control. She told me that she kind of has become almost housebound. This is a super active lady. She is active in her community. She is involved with activities out of the home most days of the week, likes to be out and about and interacting with the community. And now she's just not, because she doesn't feel good. She's not rested. She's tired. She's feeling symptoms. She's not sure what she can go out and how she can share a meal with other people or do things that are around food because she's not sure if she'll have a bad episode, and she's doesn't want to become embarrassed or become a distraction or you know, maybe even have to throw up or something like this during some kind of public event, right? Or community event. And so she very rapidly found herself kind of sticking to home, which is not normal for her. And you can see how the domino effect is happening, right? Because now she's stuck at home, she's worried, she doesn't know if she can regain her normal life again. She's starting to feel sad, maybe, you know, things like depression can creep in if we don't know if we have hope of changing this situation. This story is so common. These type of slow but consistent dominoes about how what you thought was just basic run-of-the-mill heartburn that everyone has, you assume that everyone is experiencing that in some way, and you start thinking to yourself, well, there must be something wrong with what I'm doing, with what I'm eating. Maybe it's just my fault that I'm having these out of control heartburn symptoms and reflux symptoms, chest pain, food getting stuck in the chest when I swallow, feeling like things are getting stuck, or even like a choking sensation in the throat, having to bring the food back up or throw the food back up because it didn't go down nicely, pain in the abdomen, all sorts of stuff can go with this, and you start easily blaming yourself and making little changes. Before you know it, you're not eating almost anything except super limited foods. You're not going out and doing your normal activities. You're not seeing people that you want to see. You're not participating in family or community activities that you used to, that you enjoy doing. And your world can very quickly become very, very small. You can quickly lose sight of kind of who you were and what you liked to do. And before you know it, something that seemed as silly as heartburn has taken over your whole life. This is not rare. This is not a rare story. I see and hear these stories every day. And I feel terrible that more people don't understand that this, when heartburn has taken over your life, it's not just a casual problem anymore. It has really tipped over into becoming a disease that has tests associated with it, that has treatment options associated with it, that has medications, procedures, diagnostics associated with it. And that is so important to know, is so important to get and seek them out so that you can reclaim your life, enjoy your food, enjoy your family. And let's not forget that heartburn, long-term, meaning acid reflux, causes damage to the esophagus. And that actually can turn into esophageal cancer. If all the other things about living well and enjoying your life weren't enough of a motivation, preventing esophageal cancer, I hope, is really something that we can all agree is something that really needs to be avoided as much as possible. And what a preventable issue, right? What a preventable issue. Who wants to, look back on their life and say, gosh, if only I had sought out something for my heartburn, little old heartburn, I wouldn't have ended up with a really challenging cancer to treat. We don't ever want someone to have to say that. But unfortunately, that does happen for some people. And it's my job to make sure that it doesn't happen and let you know what your options are. So I hope that this lovely patient I had today helps illustrate how this happens for everyday people in their everyday lives, turning from heartburn, the casual annoyance, to heartburn, the disease. And just like her, I hope that you come in to see someone like me to do something about it.